Ready to make a difference? This is the Palm Harbor Chamber of Commerce podcast, where we connect you with the stories behind our local businesses.
Welcome to the Palm Harbor Chamber podcast. I'm your host, Kurt Rhodes, and today we have Dr. Melissa Torres. How are you?
Good morning. Thank you so much for having me. I'm doing great.
Absolutely. Happy Friday.
Happy Friday.
Alrighty.
Yeah.
So let's jump into it.
Yeah.
Tell us about your business, because I know we had a business before hours a few weeks ago. That was awesome. Thank you for inviting us there. But the floor is yours.
Yes. So I am Dr. Torres. I am a family medicine doctor in Palm Harbor. And me and my husband, who is my registered nurse, we just opened a family medicine clinic right down the road from the chamber called Radiant Health Professionals.
Right.
And we offer a different style of care. It's a membership style. So we kind of mix both worlds. We mix both traditional and concierge together for a different concept.
Yeah.
We have a membership program, but we also take insurance with it.
Okay.
So we do more of a deeper dive, more of a personalized approach to care.
More like a white glove type of
Yeah, like an
service.
elevated white glove service.
Okay.
But also, I also call it kind of old school medicine, where, you know, your family doc knows your dog's name, knows your mom, you know.
Very
and
personal, yeah.
More personal. You get
Yes.
more time with your doctor, you know. In where I'm from in Michigan, my doctor did that, you know, came to my house, came
Right.
to my school, still calls me today, knows me, you know. And when you have more of a personal connection with your doctor, you get better. You're
Yes.
healthier.
Well,
know?
you have a better communication with your doctor, right?
Right, yeah. You feel more comfortable. You know, we try to keep it more open and relaxed in my clinic, so you feel comfortable.
Because, I mean, think back 40 years ago when I was in my teens, right, and going to the doctor, and I just remember specifically meeting with him, and he always come in and give my mom a hug and shake my dad's hand and shake my hand. How you guys doing? How's soccer? Blah, blah. So today,
It's not that way.
no, it's not. You walk in, you kind of like, you feel like a number. Sit down here.
I know.
This,
yes. Yes, we've gotten far from that. And to me, I feel like, you know, a lot of medicine and healing comes from just being there for the patient, right?
Sure.
Personal touch.
Yeah.
Hugging them.
Yeah.
Holding their hand when you give them bad news.
Absolutely.
Calling their wife in when you're giving bad news,
Right.
you know, knowing them a little bit deeper. And I think that the more you connect, you really get through to the person too. Because a lot of people have, you know, medical anxiety, medical trauma, you know, they feel like a number. Nobody listens to me. I don't know where I'm going. I don't know what to do. So when you trust your doctor, which is hard to do, you get better because you're more apt to listen to them and trust them.
So your age groups, where do you kind of range from?
Well, I see everyone. So I'm a family medicine doctor, so that means I was trained from babies to 120, you know, everyone.
Okay.
But I would say typically I run in, you know, middle age range usually find me, but it usually starts with that, and then they're like, hey, will you see my kids or my grandma or my mom? And I'm like, yes. Our favorite thing is, like I said, the whole family, you know. That's why I went into family medicine, because I love all ages. I love seeing everything, doing everything, really getting to the core, because, you know, I only see you for so much, but your true, you know, health span is with your family, right? What do you do with your family every day? Do you, you know, eat out every day? Do you sit in front of a TV all day? You know, it's the whole health, the whole picture of what you do all day.
Right. Because I think it's easier when you're able to tell your doctor everything you could know about you, but through kind of almost like kind of lifetime. And I think that's what you're saying, is that when you meet those people, say in the 20s and 30s, like, oh, I just said we have kids now, and you look at my kids, oh, my grandparents still live in this area, can you take care of them? It's very good. So what is your website? For people at home that probably want to know.
So I'm an affiliate with another national company called MDVIP. So my program is kind of based off their guidance and program. So when you find me, you would actually go to mdvip.com/Melissa Torres DO. and you would find my page.
Gotcha.
I also am pretty good on, social media, so you can find me, our business, Radiant Health Professionals, on Facebook as well as Instagram, and also I have a personal professional website for Dr. Melissa Torres, DO, on Instagram and Facebook. So I post a lot of things on there. People are free to friend me, tag me. I'm open with patients finding me. I post on there things that I find helpful, or, tips and tricks for what we're going through at the time.
Well, it's good that you have that kind of open book mentality.
Yeah.
Because people are like, oh my gosh, doctors. And,
Yeah.
I don't know if I want to see a doctor today. But I think today's world with social media,
Yeah.
having that maybe not personal interaction like you and I are having right now,
Right.
but watching it on a video, wow, oh my gosh, she's awesome. It's the education. She speaks well. She's really looking out for her customers. Maybe I will give her a call. Maybe I will make an appointment.
Right, like a personalized approach. Like, you don't have to fear me, Like, like I answer the clinic call and everyone's always shocked. They're like, no, but I mean Dr. Torres. I go, it's me.
Yeah.
They're like, no, the doctor. I'm her.
Yeah.
You're talking to me. And they're like, wow, you
This is
answer
not
the
AI.
phone?
This is Dr. Melissa.
So I just try to keep it that way so that, people, because if I don't know about you, I can't fully help you.
Correct.
And that's what we want to do, me and my husband.
Yeah.
So we try and keep it open and non-judgmental. And
Now, a few weeks ago, through
Yeah.
the chamber, we had the business
Yeah.
before hours at your office. This is amazing. Thank you for having us there.
Yes.
You had great food. You had a lot of food. still have food left over, as we were talking about before. But kind of just walk through just the simple, basic customer, so people can kind of relate to, the average doctor. I go to the doctor maybe once a year to do a physical, right? So talk about like just a typical person, maybe in their 40s, whatever you think is best, and kind of walk them through that whole process.
as far as like the physical and like joining and so forth.
Sure.
Yeah. So they would join my practice, and then, we reach out to them, and typically a patient would either start with like a new patient appointment.
Okay.
We kind of get the groundwork of like, what things are we dealing with, or nothing. Maybe you're healthy.
Right.
And then we would schedule every patient of mine gets an annual wellness physical. It's about 4 hours in length. I kind of akin it to an executive style physical, like, execs used to do back in the day in New York City. They want to keep all the top execs in good shape, right? So they put them through the ringer. So part one, we separate into 2 days because it is lengthy. So part one is actually with my husband, my registered nurse. My patients come in the morning fasting. We do an in-body scan. So you step on our scale. I check, body fat, muscle composition, BMI, caloric burn,
Okay.
Segmental analysis of muscle. Then we draw your fasting labs in-house. We airlift it to Cleveland Clinic, and they do a little bit more thorough of an evaluation.
Okay.
And then we do 12-lead EKG. We do a full breathing spirometry test. We do full vision, full hearing screenings, and then we do Dopplers of your arms and legs to look for any arterial disease or blockages.
Okay.
We do grip strength, and then we do a timed walking speed.
Okay.
And then we
Wow.
give you
Interesting.
snacks and coffee,
Because
because I don't want my
you
husband
just
out.
fasted for 12,
I know.
14 hours.
And then you go home,
Okay.
and then in about 2 weeks, we schedule part 2 with me. We have all your results by then. I create a folder, a wellness folder. I put all the results in it. I start off with a physical. I called it my old school physical in a gown, where, back in the day, the doctors looked at everything. Right now,
Right.
they don't really check much.
Right.
So I do a head to toe exam. I also do like a skin cancer check. We look for, anything.
Wow, very thorough.
If women need pap smears, breast exams, I'll do those then too. And then my patients get dressed, and then we actually come to my office. I do all the consults in my office because I feel like it's more personal. I don't
Right.
want you sitting on an exam table forever and
No.
feel nervous. So
Good info.
yeah, so you come to my office and we review all the results. No scariness. I don't scare you. We just look at all of it together, and then we kind of come up with, what are your goals for your health? What are my goals for you? Where are we going to meet at?
Okay.
How do we get there? Some patients will be like, doctor, I want to live to be 100. I'm like, all right, you're going to be 100. And then I look at the results. I'm like, it says here you smoke. And they're like, well, yeah, doc, just a couple. And I'm like, all right, so we're going to lower the age to 80. And they're like, oh. I'm like, This is what it's your health, not mine. I'm just guiding you.
Exactly.
And so that's I kind of put a ball in their court. I'm very, people always ask me, Doc, are you holistic? Are you different? I'm like, well, holistic means whole person. And that's what I do. Whole person, whether that be medications or supplements or exercise, it's based on the patient. So some patients don't want to exercise, don't want to do this. So we go on them, and you'd be surprised at how many say no in the beginning and then come around and they're like, you know what, I thought about it, and because we have such, close talks, they usually do come around and lifestyle gets improved, health gets better, It's
a personal touch.
Yeah, it's a marathon, people, this is a huge physical, but it's an onion we're peeling away here.
Right.
Sometimes that takes a while to get to the core.
When you say your physical, I know you said part 1 and part 2, so there really is only 2 parts to this 4-hour.
Yeah, it's lengthy.
Okay, so part 1.
2 hours.
So when you said part 1, you said you send your stuff to the Cleveland Clinic to do a more thorough search, right? So how long does that take to come back, typically?
Oh, about 2 weeks.
Okay.
Yeah, that's why we do. We wait.
Right.
Because I want to have everything there for them to see.
Right.
Because the blood markers will look a little in depth. Like I can see, presence of coronary artery disease, active coronary artery disease, active inflammation, pre-diabetes, insulin resistance, all types of different markers where, normal traditional doctors don't look that deep, or they're not trained to look that deep.
No. Yeah.
So I can be like, I know we think we're healthy, but what's going on here? Maybe we need to look a little at this area. I'm worried about, why are you so inflamed? What is going on that I'm missing?
Okay.
So then we kind of dive deep there. Even my athletes think I'm working out and I don't drink, don't smoke, but I'm like, but something we're missing here, like what happened in this area and so we kind of dive deep, and I actually have prescription pads. Mine are exercise, nutrition, behavior. And then I kind of go down like, so tell me a typical day, what are we doing? What exercise do you do all the time? Oh yeah, I do a bunch of cardio. Oh, but do you skip leg day? Yeah, I do. How did you know that? I'm like, well, the in-body scan showed me you're completely weak in your legs, or all these other things that,
right.
And then we figure out the reason. So it takes that kind of in-depth look to really tease out the problem.
Do clients come to you and kind of hold back information to
Sometimes.
where you
I find
see
it.
the search and you find exactly?
My husband
Sometimes
always
people,
laughs.
I think, well, maybe are embarrassed or, no, I really don't want to bring that up. It's too personal.
Yeah.
But I think once you start peeling back the onion, doesn't that kind of that personal kind of stiff arm go away?
It does.
They really
yes.
start to attach to you now, right?
Yes.
Because they really, she is really peeling back the onion from head to toe.
Yeah, it's true.
And
it's so
very
funny.
important to learn more about yourself, no matter what age you are.
Well, in looking back, I'm almost like a reflector.
Yes.
I'm like, okay, but where is this from? And we'll think about it and we brainstorm, and the patient's like, well, this. And I'm like, this is it,
Right.
And then we kind of figure out, like, maybe we need therapy. Maybe we need something else that we're missing, And that's kind of the cue. And my husband always, he laughs but he's like, you're kind of like their therapist, aren't you? I'm like,
yes, that's exactly. You stole the words right out of my mouth. That's what I was going to say.
Yes.
You are a therapist.
And I'm like, yes, it is, and I'm also,
You wear many hats, don't you?
I love it. But that's kind of how you get.
You're very passionate about it.
Yeah, I love it. I love getting there. And, I think we miss that core. If you only look at medicine and science, you're going to miss the emotional, cognitive, spiritual community part, right? We need a community too, like to live long and prosper. We're going to forget all those. We don't look at those parts.
One of the categories you were talking about was behavior.
Mm-hmm. Right.
So that's very interesting.
Behavior, yeah. And I have, it's hard to address. People want to hold on to their behaviors, right? And
Sure.
we somewhat glorify a lot of our behaviors, right? And so I've learned an art about it and how I can get there. I'm very non-judgmental. I don't we're not here to judge you. I'm literally just here to help you.
Right. But get
anyway.
everything out of the open.
Yeah, like I'm like, okay,
so
what
we
am
can
I
diagnose
missing?
it.
You know, what am I missing? And
Yeah.
you know, and I really do. I feel like I help people look in the mirror and be like, listen.
Well, I think what's interesting,
Yeah.
and how long have you been a doctor? I forgot you how many years you.
I have been a doctor 15 years.
Okay. But you just had yesterday. You
Yes.
said you had a 1 year anniversary.
Yes.
Okay.
Yes.
And you had 100 of your patients, and you took care of them with foods and drinks and stuff like that. So, I was curious. Was there any kind of testimonials that people said, "Oh my gosh, thank you for inviting me, but you changed my life. You changed my behavior. You changed what I eat."
Yes. And
Awesome.
it's very interesting too, is that so some of my previous patients before I opened this clinic came and found me and show up. I mean, I haven't seen these patients in 5 or plus years, you know,
Okay.
and they came to it and I was like, you know what? They just like, thank you so much. You're the most amazing doctor. Thank you, you know, for what I did even back then came today, you know, yesterday to the event, you know, and I just feel like, and one of the behaviors I touched on, so we had a mobile bar, but it was all sober. It was mocktails. It was non-pressuring, healthy.
Yeah.
You don't have to feel like you have to engage, right? And I felt like that was a good,
Yeah.
helpful reminder of behavior, and I thought that was really cool. And I think a lot of patients appreciated that too,
Okay.
that you can still do that without.
What kind of food were you serving?
It was amazing. What do we have? Tzatziki, spanakopita, sandwiches,
So you
tons
went
of.
with Greek food.
Yes,
huh?
well, kind of mixed
All right.
bag.
Okay.
It was good. I had a little goodie bags with some healthy stuff,
Yeah.
protein powder, collagen, stuff, trying to, put my behavior messages out there, but
That's great.
it was good. And I feel like, my biggest compliment is when a family member joins, right? Because that to me is you trust me that much, you give me your loved one, right?
Yeah.
That's a huge, and the fact that most of my patients brought a loved one yesterday, that's, really means a lot to me.
Awesome. So let's switch gears a little bit.
Yeah.
Because I know you are part of the Palm Harbor Chamber now,
Yes.
right? So I just want you to explain to me and our audience your experience of day one joining a chamber, day whatever it was when you actually came to one of our events, and kind
Yes.
of what your experience was.
Yeah, so as a doctor, we do not learn networking. We don't have to.
There's no manual like playbook or.
In traditional practices, you just show up to work and they're line out the door for patients, right?
Yeah,
You didn't
yeah.
have to network.
Okay.
So opening my new business, I'm like, oh my gosh, I gotta learn this new skill, right? And so I joined, I don't even know if I opened yet, but I joined Palm Harbor Chamber. And honestly, it was immediately just so welcoming. And Matt, the president, was just so overly, just like almost like a teddy bear, like, oh, Melissa, come in. And I even came over. I was like, well, I guess I got to go to that chamber. And I don't even know what a chamber is, We don't know. So I came in and they were just like, bring all your stuff. You want to use this building you can come here. I'm like,
Yeah.
what?
Yeah.
Like, you want to be a speaker? Do you want to? And it was just so, open and welcoming and just very non-pressury. Some networking groups are a little more pressured, which I appreciate. But it was just very, I don't know. Everyone was very kind. I love Palm Harbor, though. This is definitely the Palm Harbor vibe
Yeah.
of open.
You've lived in Palm Harbor
Yeah.
for many years, and I have too. I think a lot of people sometimes don't understand, like you said before, what a chamber really does.
Right.
And to be able to, I look at it as killing two birds with one stone. When I joined 7.5 years ago, is like a networking opportunity, but also to give back to our community.
Yeah.
Because, being unincorporated, we don't have a city hall, so we have to kind of do things ourselves to make things happen. So,
Right.
and some people have to make decisions. So we have a board and what have you, and they kind of make a decision. They agree to disagree on a lot of different things, but it's good communication because I love Palm Harbor. I've been here for over 50 years.
Yeah.
So it's nice to when I joined the chamber, they had these qualities that kind of mirror my image, if you will.
Right.
So that's what's nice about it. So I tell people when they're watching these videos, oh my gosh, you know what? I've heard about the Palm Harbor Chamber, but I've never been part of the chamber. And what I encourage those people to do, and you probably would too, is be a guest.
Yeah, come
Come
out.
up, see what it's like. Maybe you have your own business. Maybe you're retired. Maybe you, whatever the case may be. Some people come just to, I have friends that they don't really network. They want to just help community. They want to help like Feast Food Pantry.
Yeah.
They want to help what's going on around here. They want to volunteer for different community services that we do to help our community. So that's the cool thing about it is we all kind of come together as one to help each other.
Yeah, it's very giving. It's
very giving.
It's very giving. It's so funny. So I had a lunch scheduled this summer, and I remember thinking, I should probably pay the bill for this. And I was like, I don't know what I'm supposed to do. I emailed Matt.
PalmHarborChamber.com.
And I was like, Matt, do I need to do something? He's like, no, we got it. We just want to learn about your business. And I'm like, that was just so amazing, And I even told some of my colleagues, they're like, what?
Yeah.
They just want to learn about you and you just show up? I'm like, yeah.
Well, I think when we have guests come and they don't have to pay for their lunch, right? I think it's come and see if this is a fit for you. Right. It's as simple as that. And I think when they come for our luncheons, we have sometimes, 40, 50, 60, and in the Christmas time, we have almost like 70 people come out. Everybody comes out of the woodwork when it comes to holidays, it seems like. Yeah. But, I mean, we're probably averaging about 50 people for our luncheons. Yeah. So there's a reason.
Yeah, I mean, it's awesome. I was like, that's amazing. So, no, I think it's been more than welcoming and learning, definitely, because not only do I network to, like, get business, but I'm also learning how to own a business, right? This is the first one I've ever owned or done.
Not always easy.
It's not easy. So when you have people to lean on.
Exactly. So what do you think your biggest challenges were when you actually started a business?
I would say learning how to market, learning who to market to. Right. Learning who my, customers were, learning how to have business relationships, right? Because, again, that we don't learn that either. I mean, so those were all, I think I'm definitely there now. Also, public speaking, not doing this. Yes. Like, sometimes doctors do that, but it's not very common, or...
No, it's not.
Or even, learning other skills, talking to professionals I would have never thought I would, electricians and, learning so many other skills and how they do their business really translate into how you can do yours,
I think it's interesting when we have so many different events at the chamber, from morning events to our luncheons to we have some social events thereafter. But 9 times out of 10 we do kind of like a 30-second commercial. Yeah. So people, if you're listening, our audience, when we do that 30-second commercial, we really want you to explain what your business is about in a nutshell. Again, 30 seconds, so we keep it to 30 seconds. But listening to all the people that are in there, you are going to maybe pick up on things. Like, wow, I should be talking about this, or wow, that should be, or oh my gosh, I should never do what that person just did, because not everybody's perfect. But guess what?
You
people
learn.
That we talk to, that are newer members, like, well, I don't really like to stand up and do the 30-second commercial. I'm not sure what to say. I go, but you're a business owner, right? Yes. How long have you been a business owner? 20 years. Have you ever done a 30-second commercial? No, I don't think so. But when they stand up and they do it, they realize, first of all, they don't go first. We give them kind of an audience, the 30 people in front of you, okay, now you're the 31st. But anyways, they have a better sense of what to do. Yeah. But you see them, and I know there's a specific people that are probably going to watch this video, and I'm not going to name any names, but they came to our chamber, and they just were flat out terrible about getting their message across. Stumbling, fumbling, rumbling. Now, fast forward just 6 months, and their whole tune has completely changed. Their speaking skills are a lot better. Their listening skills are a lot better.
Mm-hmm.
And they get their message across.
Right. A 30-second elevator pitch takes a lot of work. And when you do those all the time, you ace it. After a few months or so forth, you understand what people want to hear because you're hearing everyone else's.
Right.
You know what you want to hear.
Right.
And then you kind of fine tune, what is it I'm doing really? You know,
Right.
like, what do people want to have what I'm doing, you know?
Members come up to me and say, Kurt, did you listen to my message? I go, yes. Like, oh my God, I was just rambling. It's like I was throwing up in the mouth. I go, you were. And they're like, wow. I'm just going to tell you how it is, right?
Right.
Like, hey, next time you come in, try to perfect that. Go
Right.
home, look in the mirror. Do your 30 seconds to yourself or your family members.
Mm-hmm.
When they come back the next time, they're like chomping at it. They're ready to go because they want to get that message out.
Right.
And people go, oh, I didn't know he or she did that. Because the last one was just throwing up at the mouth.
Right,
You didn't
right.
have any idea what you were doing. And people that actually go over the 30 seconds, a little annoying because, listening skills, right? I say 30 seconds, you're going to do your presentation for what?
30 seconds.
Right. So fine-tuning things is key. It's very important. Get your message across.
Right, and I started realizing I'm driving in the car and I'm like hearing people's 30 seconds and I'm like, how did I keep hearing that one?
Yeah.
I'm like, that's something they said
Right.
stuck
Trigger
in my
something.
head.
It did.
And I'm like, that's what I need to do
Right.
next time,
Right,
you know?
right.
But it's really interesting, you know. I was shy too, and now I'm like, now it's kind of fun. I want to hear what they're gonna do, you know?
So let's fast forward.
Yeah.
Dr. Melissa Torres, 5 years from now.
Yeah.
Where do you see yourself? Where do you see your business?
Well, I would like it to grow. I'm not gonna take more than probably 300 patients, but I would like to eventually, have a day in the week where I want to give back. I actually love that. Me and my husband, if I could go, work at women's shelters, whatever, or even teaching doctors how to be like me, how to not work for the system, how to follow your passion. Because I always say every doctor wants to be a doctor, but sometimes they're stuck in a way that they can't, right? I want to show them that you don't have to just follow and follow and follow. You can get out of that system and be the doctor you're supposed to be. Because the more I do this, the more I feel my passion come out and my patients feel it.
Okay.
And so that's what I envision that, being more, I would love to do like house calls and even boat calls, go out on the ocean and do that too, and, 10, 15 years down the line, I want to have my children come with me, They don't have to be doctors, but kind of showing them that one business mindset, but also being in the community and helping the community mindset.
I think when you can make yourself a little bit more diversified, because I think sometimes we get into a mode to where we just kind of focus on me or us, right? And I need to do this, I need to do A, B, and C. But then when they find out through the chamber that, oh my gosh, there's a community that really needs outreach, you need help.
Yeah.
For example, the Feast Food Pantry, many years ago, we're sitting at one of our chamber events, and a lady comes in, she was crying, talking about Feast Food Pantry. And their problem was that they didn't have enough food for that month to give away. Within 3 minutes, literally 3 minutes flat, we had $1,850 to give to them.
Yeah.
They were floored.
Yeah.
They were floored. They obviously get a lot of heavy discounts from the Publixes and the different stores around them, but they were able to go buy food for the people. Now, at that time, they were serving about 1,200 families a month. Now, fast forward 6 years, now we're at almost 5,000 families a month. And again, it's mainly just in our general area. So we look at Palm Harbor going, well, Palm Harbor has quite a bit of money. Right? But
you don't see it.
You don't see it,
Yeah.
right? Because we have I don't know if you want to call it a blind eye, because like again, you're focused on your business, right? I'm focused on our business. But when you start to find out a little bit more about your community and where it needs help, and you start to volunteer and help for that, it just gives you a different perspective in life.
Yes.
You know, I love giving back. I love volunteering my time. It just it makes my heart feel good, and I know I'm helping.
Right.
I'm doing some type of help to help our cause in our general area.
Right.
So that's what I encourage the people at home watching this video.
Right.
We know we're talking about Dr. Melissa Torres, but we're also talking about you growing and trying to volunteer and help out in different aspects right in our county. Because you love Palm Harbor. You already said it. So do I.
I know, and it's true. And I always tell people, you know, even my kids, you're going to see hate on the TV, hate everywhere else. But when you actually go out in the community, I don't see that.
No.
I see love, acceptance, openness.
Yes.
And if you really look, you will find not everyone's like us. You know, not everyone has everything. Maybe they're struggling here or struggling there. I think the biggest wake-up call for me was learning that in Palm Harbor, lunch is free. And I was like, I didn't realize we were struggling that much, that we needed that much, you know. To me, growing up, you know, we were lower class and I got lunch free, I got breakfast free, but it was only a couple kids.
Right.
Not everyone.
Yeah, when that light bulb turns on as we get older.
Yeah, and I'm like,
Sometimes people see it earlier, and sometimes people see it later in life. But I mean, when I joined the chamber in 2018, I gave back to a couple things, but I never knew the how bad it was. I shouldn't say how bad it was, but when you live a certain lifestyle and you start to understand the unprivileged people that don't get everything, and you realize you try to help those people, it's amazing just the love that's out there.
Right. That's what I see in the community.
Because
and
we're all human.
Yeah, we're all out here.
We breathe air.
We're all trying to do the same thing here.
Trying to be successful, trying to help people out.
Live your life. And that's actually why, so it was crazy. I never knew Palm Harbor existed. And we were moving, we wanted to be over by the coast, right? And we drove through here and I was looking and I'm like, what is this town? I'm like, it's like the Keys, but like in the middle of Florida. And it's just like so fun and chill and like everyone's so nice and
Paradise.
like, you know, even going to the Crystal Beach Publix is fun. It's like so calm, you know?
Exactly.
And like, this is so nice and like, you know, loving. And so that's why we even came over here. So that's why when we opened our clinic, I'm like, no, it has to be here.
Right.
This is my community. I want to be right here.
So in closing, let's go just a little quick recap of Dr. Melissa Torres and her business. And I know you have a husband, obviously. How many kids do you have? You have
Three.
Their ages are?
11, 8, and 1.5.
Woo,
Yes.
Boy, you are a busy woman. Okay. So let's go back. Let's talk about a little bit more about your business. Just to recap it. The website, Instagram.
Yep. So it's Dr. Melissa Torres. It's Radiant Health Professionals. Me and my husband, registered nurse. It is only us two in the clinic. My website, mdvip.com/Melissa Torres DO. I'm a DO. And socials, so Dr. Melissa Torres DO on Instagram, also on Facebook. And then we have a Facebook page, Radiant Health Professionals.
Awesome.
So you can reach me anyway. And you can also call my clinic. I answer the calls. And, you know, we're always open for patients. You never have to be pressured. You can come in and meet me, see the clinic, sit down with me. I explain things and go from there.
Well, thank you for coming in.
Yes, thanks for having me.
I'm glad you're a chamber member. I'm hoping to see you in more events.
Yes.
Maybe get your husband to come out there.
I know. We got 3 rugrats. We got to drop off. And
it's going to be hard.
shift.
I know. I'm not saying it's
I know, but
an
we
easy
do.
task.
He wants to. He does.
So for people out there, you actually go to palmharborchamber.com. You can actually go on the website, and some people are like, hey, you know what? When's the next event? Well, on that chamber website, you can go to actually the chamber events. It'll throw out the whole month.
I
Say
know.
right now we're in September. It'll throw out the whole month of September, what location it's at, what time it's at. And so if you want to join, you want to look at it as being a visitor, you may do so.
Yeah. You guys
Come check
always
us
have
out.
amazing events. It's always popping. fun
Well,
stuff.
enjoy your weekend. Thank you again,
Thank
Dr.
you so
Melissa
much.
Torres
Thanks
here.
for having
Appreciate
me.
it. Thank you so much.
Thank you.
Don't forget to subscribe to the Palm Harbor Chamber newsletter for updates and the next episode. A big thank you to our trustees for their incredible support. This podcast was produced by ABS Photo and Video.